Welcome to the Medical Report Podcast, where we bring health to your ears. Our podcast hopes to help the community learn more about health, but we do have a disclaimer that all medical advice shared here is not an adequate means to diagnose or treat you. We recommend that you seek medical attention from your healthcare provider if you want more guidance on your health. Or if you'd like an assessment by one of us here on the panel, you can reach out through our social media pages. If anyone in the audience has any questions for us individually or about our topic today, please feel free to leave your questions in the chat, and we'll answer it in our Q&A segment later in the show. If you're watching this after our live show ends, feel free to ask your questions in the comments too. Also, be sure to like and share this video. We want to feel the love. Now, let's get on with the show. Hi guys, welcome to the Medical Report, where we bring health to your ears. We are your hosts, Zinzele, and I am Anita. We're excited to talk to you today about an integrative approach to cancer care. But before we get started, how have you been, Zinzele?
I've been good, working and working and working.
Yeah, me too. It's been really hectic. Just a lot of work, seeing patients, getting a lot of love from patients, which I've always enjoyed.
Yeah.
And yeah, just every day momming it, wifing it.
Yeah. I had a great situation yesterday where a patient decided she wanted to tell me off, and then within 30 seconds said, "I love you." Dementia patients.
Right? Just a little back and forth. There's always like a love-hate relationship, right?
Yeah.
We love to hate, but we all that other stuff. Yeah.
Yeah,
It's always fun taking care of people, though. It's definitely my favorite part of the job.
it is.
So let's get into our topic today. Today, we have the honor of speaking with a nurse practitioner and the owner of Howlett Integrative Cancer Care, Miss Kristie Howlett. Howlett Integrative is a telemedicine practice that serves patients in the states of California, Idaho, and Nevada with the goal of helping patients increase their immune function and decrease toxicity of chemotherapy and radiation treatment. Can we please welcome Miss Kristie? Hello.
Hello.
Hi,
Thank
everybody.
you for joining us today.
Thanks so much for having me.
Of course. Tell us a bit about your nursing career, Kristie.
Well, I started out my nursing career with a Bachelor's of Science in Nursing from the University of Nevada, Reno. I worked up in Reno for just about a year before moving down to the Sacramento area. My entire career has been in oncology care, so working at the bedside for an extended period of time, went in and did some management, worked in the IV therapy realm with management as well. And decided I needed to do more, so I went back to school and got a Master's of Science with a focus in oncology nursing from University of California, San Francisco, and became a clinical nurse specialist. And about 4 years into that, I just knew there was more that I could do for patients. And listening to you guys kind of banter at the beginning, I love patient care. I knew management wasn't for me.
Yeah.
And so I did a postmaster's certificate through University of Boston, Massachusetts, as a adult geriatric NP.
Woo-woo.
And so I've been doing that ever since, and never really looked back. Love it.
Yeah. Patient care is so fun. I really enjoy doing that interaction with people. I think that's the best part about it. I mean, even just their stories that they'll tell, or just talking about their day-to-day outside of just the medical stuff. It's always good.
It can really make your day. They
for sure.
They don't realize how much impact they have on our lives.
Right.
Yeah,
and that,
so rewarding.
I mean, obviously, Anita, you being a nurse as well, I mean, that there's so many avenues for nurses, depending on what specialty. I talk to nurses and they're like, oh, I'm a psych nurse, or oh, I'm pediatrics, or I'm labor and delivery, and I'm like, oh, thank God for you, because I could never do those things.
Right.
And when I tell people I'm in oncology care, they're like, oh, I'm so sorry. That must be so hard. And I think, well, yeah, there definitely are some days where it's super hard, but it's the most rewarding thing I've ever done in my life. And I I can never leave it. I love the science. I love the art of it. And I love the progression of where my career has gone and being able to open up my own practice.
Yeah.
I
Looking
feel
at
the same way.
integrative medicine, what is an integrative medicine practitioner?
Well, so it's interesting, traditional treatment, if you think about traditional cancer treatment, it is surgery, chemotherapy, radiation, and pretty much that's it. You kind of go in, you get whatever done, and for the longest time, there wasn't an approach on looking at the other pillars of health or the foundations of wellness, and those things being nutrition, exercise or movement, sleep, stress reduction, relationships. And so the integrative approach is, how do you manage all of those things
Hmm.
to give the patient the best outcome? And, looking at the whole person versus just looking at their cancer or their side effects from the treatment that they're getting. So looking at something from an integrative standpoint is you're looking at them very holistic. You're focused, or you're emphasizing that therapeutic relationship between the patient and the practitioner. And then you're using all of the appropriate therapies. So whether it be food as medicine or supplements, or recommending yoga or tai chi or something along those lines, it's all the things.
Yeah. Yeah.
Yeah. So, how does your integrative approach differ from traditional cancer treatment? Like, what are things
Yeah.
that you kind of, like you just said, you focus on other integrative things that, like exercise and things of that nature. But when
Sure.
you're seeing these patients, what are things that, I guess, how do you come up with that plan of care for your individual patients?
So it really depends on what's going on with the patient. So
Yeah.
what is their diagnosis? Where are they at in their trajectory? Are they just getting to me because they are about to start treatment? They've just been diagnosed and they're about to start treatment. And then we want to set a plan that helps them get through their surgery, their chemo, their radiation more successfully? Or are they getting to me after they've completed all of those things? And we're looking at, how do we rebuild their immune system and get them strong and healthy again? And hopefully, the goal is always to prevent them having to deal with the cancer again. I mean, we can't take that risk away per se, but we can
Right.
do the things that help decrease their risk. And so it varies, it's very much individualized to the patient themselves. And then I always say, like, when you go to a traditional practitioner, the plan is set, right? You're going to do this, you're going to come on this day, and you're going to get this treatment, and you're yada, 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 yada. And for me, when I see a patient after they've done all the intake forms, I start to build the plan of what I think would work for them. But after our initial consultation, which is 90 minutes long, then we really formulate it collaboratively and go over, okay, here's what I think would work for you, but where are the stops for you? What do you think is just not going to be doable? And then it becomes this partnership of, where can we improve the dynamic for you? So it's so individualized.
Right. That's awesome that you kind of get to go, instead of it being so structured, this is all it is. Like, you can kind of integrate as you go in,
Right. Well,
whatever's
and what
going
I've
on with that patient.
found, sorry to interrupt you, but I was just going to say, what I found over the years of working in traditional care, it can be very cookie cutter in the approach. So very algorithmic or very cookie cutter. And there's so many things that patients want to do. I mean, in my experience, patients get a diagnosis of cancer, and the first thing they do when they walk out of that oncologist's office is go to the internet. And
Yes.
they're Googling everything.
Yeah.
And they might start taking a certain supplement, but thinking that they're doing the right thing. And really, that supplement might be problematic with the chemotherapy that they're getting or the treatment plan. And so my focus when I was in traditional cancer care was to help them navigate that. So, because what happens a lot of times is traditional oncologists or practitioners will say, you can't do anything supplementally wise and eat whatever you want.
Yeah.
Just get calories in.
Right.
And at one point, I used to say the same thing, but when you know better, that old saying, you know better, you do better, right?
Right.
And so I want to make sure that patients do those things correctly and safely, because when a practitioner comes at the patient and says, you can't do anything, in my experience, what has happened is then patients shut down,
Right.
and they still do them,
Yeah.
but they don't tell their
Tell them.
practitioner. Mm-hmm. And so I've had patients say to me when I was in a traditional practice, well, I'm still taking X, Y, and Z, but don't tell my oncologist. Mm-hmm. And I'll be like, well, I kind of have to document that. But here's what I want you to understand about these supplements. Like, you can't take them at this time. And
so basically you were doing this job while you were in your job before.
Yeah.
So
yeah. But still being kind of tied to the traditional setting. And so trying to walk that fine line is really difficult. And so, yeah, that's when I thankful. I mean, I guess the benefit of what came out of COVID was, oh my gosh, I can do this. I can go out on my own, where I would have never thought to do something like this. And there's a lot of backstory there, but it's been a really big positive, because I can still continue to help patients and do it the way I think is really important and safely for them. And to be able to do it all telemedicine over Zoom or whatever program is really fantastic, because especially those patients who are going through chemotherapy, and now with COVID, they don't want to get out. They don't want to go somewhere extra. Yeah, so just having that modality, I think, is really helpful.
Yep.
Are there particular type of cancers that you treat?
I treat everybody, but generally where my bread and butter, if you will, are solid tumors more than your leukemia and lymphomas. And in the solid tumor dynamic, I see a lot of breast, I see a lot of colorectal, just generally because that tends to be the population that knows me from my previous practices as well.
Okay.
And how long do chemotherapy and radiation treatments generally last? I'm not really super familiar with how long. I've obviously referred patients if I find something, because I'm more in the primary care realm. I'm like, okay, we'll see a specialist now. So how long do you normally see your patients for when you're taking care of them, based on, I guess, different diagnoses, I'm sure?
Oh, it totally depends. I mean, for your typical breast and colorectal cancer treatments can last, if we're in a survivorship or a curative state or going for cure, they can last up 4 to 6 months long in treatment with just chemotherapy. And then if there's an added component of radiation on top of that, that could be another 4 to 6 weeks. And then depending on where surgery is in the mix, that plays a role. So sometimes patients are undergoing treatment for almost a year, trying to get through that traditional dynamic. And then, so depending on what's going on in my business, will see them periodically throughout that time period. It really depends on where they're at. Sometimes the initial consult is just about setting a plan to get them through chemotherapy, and then they come back at the end when they're feeling, when chemo's done and they want to rebuild. But along the lines, I operate kind of very concierge-like. So they have they have access to me, whether it's through texting or through email. I just really want to make sure that patients get good care.
Yeah, I know from personal experience, there were some neuropathic or issues with pain, some neuro pain. And I remember one of the doctors, we're thinking, oh, we need to get some serious medicine. We're having neuro pain, right? And he said, no, just take some vitamin K. We're like, huh? Just go to the drugstore?
Yeah.
We're like, what? So, you never would have thought of something like that. How do vitamins and supplements impact chemotherapy?
Well, so again, it's very individualized. So for some patients, depending on the agent or the chemotherapeutic drug that they're on, they cannot take certain supplements. And that's a really big, important point to make, because so many people will take them, and it's estimated that dietary supplements are used like 2 to 2.5 times more than your mind body based therapy. So things like massage or yoga, and their majority of them are self prescribed. So patients, you go to the drugstore and you think, well, I'm at Costco, it's a big bottle of something, it's got to be safe because it's over the counter, it's a supplement, right?
Right.
And there's some that are really problematic with chemo, and there are some that are not. And so we really have to keep that in mind.
Yeah, that makes sense. I mean, I've had some patients that are just, well, it's not specifically that says it's a vitamin. People will take Tums. You popping Tums all day long, and then their calcium levels sky high.
Yeah.
And I'm like, okay, hang out and just chill on the Tums. That's why there's a certain amount you can take.
Right. And so that kind of speaks to, well, we got to dig deeper of, well, why are you taking all the Tums?
Right.
So I tell people, that's kind of getting into the functional medicine side of the root cause of disease, the how and the why. And while with a lot of cancers, we may not be able to pinpoint those things, we can always start at the roots with those foundations or pillars of health, and improve those so that maybe they don't need to be popping the Tums as much as they do.
Right.
And that's the hard part for people to recognize, I think, sometimes.
So what made you think of telemedicine as a good approach for your practice?
Actually, again, this kind of came out of COVID, because when COVID happened, I was working for Kaiser Permanente at the time, and there was already a push to do more telemedicine visits because of the benefit to patients.
Right.
And I had proposed, I did a lot of survivorship at my last practice. And so I had proposed, the initial, rather than people getting back into their routine and then having to come for another visit, why not do it over telemedicine? Because at that point, I don't need to put my hands on somebody, but it's really a dialogue of how do we help you move forward. And so I had proposed, doing some more telemedicine in that realm. And then COVID happened and everything went online. And we weren't even seeing patients in the clinic for almost 3 months unless it was absolutely urgent. And as time evolved, I was like, wait a minute.
Yeah.
This might work for me doing my own practice. And actually, it has been really fantastic because I can reach patients who are, in different states, or they're in California, but they're in Southern California, that's a 6-hour drive.
Yeah.
And to be able to meet them where they're at in the comfort of their own home. And then on top of that, I think it's kind of a cool dynamic because you get to see people in their natural setting, if you will. And that, I mean, Anita and Zenzele, I'm sure you can appreciate too, just being able to see and connect with people. There's so much of our assessment goes into just observation, right? And so that dynamic, being able to see people in their natural element or their home, and is it chaotic? Can you feel the stress even through telemedicine?
Right.
Do you have to tell somebody turn on the light because they're still in bed and you can't see their face? And so I think it's been a great tool that I would have never thought was a big deal until this all happened.
Yeah, my business is also completely telemedicine, and
Yeah.
I completely connect with my patients. Just it's so rewarding, because a lot of times they'll come to me because they don't have access to a doctor for like months, and
Hmm.
they're like, my next appointment is not can't be until January, February, or whatever, and they're like, but I need someone to see me, or they're like in
Yes.
a very rural town.
That's what I was
Um,
going to say. Sometimes it's remote.
Yes.
yeah, and so it's those things. I think it's super helpful to, especially during COVID times, to be able to
Yeah.
have to give them that access to a provider, and I think that's so great, especially with the patients you're treating. I mean, they're immunocompromised, and I'm sure they're afraid to just be around other people in general when they're going
Yeah.
through chemo,
Yeah.
radiation, and all of that.
It's just one more level to meet people where they're at. And I
Right.
think when you've got that tool and you're truly listening, it doesn't matter if it's in person or if it's over telemedicine. I think at the end of the day, people just want to be seen and they want to be heard.
Right. I agree. I agree.
Yeah. I noticed with COVID, trying to get through people through COVID, post COVID, even when you get a diagnosis, people like to shut in as if they're on COVID already. They don't go
Yes.
anywhere, they don't do anything. Is
Mhm.
counseling involved in some of your treatment plans?
Yeah. So because of the way my practice is structured in regards to the concierge type dynamic or the coach kind of dynamic, depending on the situation, I will kind of, depending on where the patient's at, I can kind of handle some of that dynamic. But if it gets too outside of my comfort zone, then I have people that I pull on, whether it be from a counseling standpoint, a social work dynamic, or, you know, I a nutritionist if there's a component of dietary that I can't, I feel is a little bit too much out of my scope, or it's a little bit too depth, or there's in depth, or there's something that's just not right, then I'll reach out to some resources that I have access to as well.
Yeah.
Okay. Hey, audience, just a quick interjection. We're going to start our Q&A segment. So if you have any questions, leave them in the comments and we'll answer them as we go. So, Kristie, do you accept insurance?
I do not. I'm 100% cash pay. I really tried to keep my fee structure appropriate and not outside. I mean, I make the joke, but I'm not out to make $1 million. I'm just out to give really good care. So I try to
Yeah,
keep my fee structure reasonable so that patients could afford it. But,
right.
Anita, as you know, when you're tied to the insurance dynamic, you are limited in how
That's
you
true.
can treat patients. And the fact that I can do a 90-minute consult without any questions asked is really, really cool.
Yes, it is. I'm also cash pay, so I totally get it.
Cash
Yeah.
pay.
Yeah.
We're all
I
cash
mean,
pay.
the insurance world really makes things more complicated.
From your documentation to your time that you can see patients to what
Yeah.
you can order.
And then even if you order them something and you try to bill for it, they'll say, "Oh, well, we don't think it's appropriate." So I'm like, "Wait a second, do I
Right.
have a degree or do I have a degree?"
Right.
Hold on.
Right.
Yeah.
But
I always tell patients they don't realize how much the insurance company is in charge of their care.
Yes.
I
They
think
really don't.
the thing that really gets kicked back the most is like lab work. So like
Mm-hmm.
if you order labs, um, I guess maybe more frequently than they recommend that you order them, then they will not like
Right.
reimburse it or something like that.
Right.
And so sometimes I get stuck on the patient and then we look like the bad guy. But it's like at the time it's appropriate.
Well, and I will tell you from a lab perspective, I really try to work with their oncologist or their primary care physician to say,
Yeah.
here's the labs that I want drawn, really diving into metabolic health, inflammatory dynamics to see what we can do. And because then it's covered by insurance. If I
Yeah.
order it, it's not. And so if I can work with their primary care or their oncologist, it's a win-win for the patient. And majority of the time, the clinicians are like, yeah, no problem. Because I'm not ordering any really wackadoodle or esoteric
Exactly.
labs. I mean, these are pretty standard, although I do get some kickback on some things, which I find interesting, but
Yeah.
it is what it is.
Are you received well by the physicians oncologists kind of stepping in, or do they feel like you step on their toes? Or
It definitely, that's a really interesting question. It depends on the oncologist. So if it's a local oncologist to where I kind of have worked for a while, they're super supportive.
right,
If they don't know me, then they get a little bit, there's some concern. I had a patient recently whose doctor said, oh, stop all the supplements, stop the medications that she put you on, that's not going to help you. And here we are, like in a metastatic setting where at that point, why not try everything?
hmm,
And so it depends on, it also depends on how the oncologist was trained too.
right,
So if they were trained in an academic setting that had an integrative oncology program, it's a totally different ballgame. Like they don't even bat an eye. They're like, great, do whatever. But if they're not, or they don't have any experience, then it becomes a little bit more dicey.
gotcha.
Yeah. It looks like Lucius has a question. I take regular PSA tests, which have come back negative to date, but it remains a concern of mine. Have you treated any men for this type of cancer? Any other information?
So looking at prostate cancer, and yes, I have treated men with prostate cancer. It's interesting to do, it's hard to say the whole situation, but doing regular PSA test, is there a history of prostate cancer? Is there not? What are they looking for? Are they doing anything else? But yes, um, yeah, that's kind of a hard
Even
question
if
to
there's
ask.
like a family history, usually that's
Mhm.
when we start doing screening in primary care. It's like if you have
Yeah.
a family history, and then once you reach the appropriate age, then we will start the screening. Usually, I think it's about 40.
And
That we
even that now with PSA testing is questionable. Some are recommending not even looking at PSA testing for the general population.
Right.
So
Mhm.
unless there's those other dynamics,
Yeah,
yeah.
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 So I think that yeah, with men in general, I mean, sometimes your prostate level, PSA level can be elevated, even if you have something like prostatitis, which is not
Yeah.
even correlated with cancer. But
Right.
these are all things that have to just kind of be factored in when we're looking at
Absolutely.
labs. So
Well, and that's an interesting dynamic too, is looking at some of the other cancer markers, especially when you're in the survivorship phase. And there really isn't a recommendation to look at some of those things any longer. Because sometimes if you're cured
yeah,
of the cancer, let's just take breast cancer, for example, and there's two different tumor markers that sometimes clinicians will look at. Well, there's no real recommendation to continue to do that because you can get some false positives, and patients will, you get an uptick in a lab, and then patients freak out,
yeah.
and really it was just that they had a common cold,
Mm-hmm.
and you see that uptick. So then you've got to do another lab in a month or 2 months, and there's that anxiety that goes along
Right.
with it. So there's so many factors from a mental health standpoint that play in as
Right.
well.
Yeah, definitely. I mean, it's scary. Anytime,
Mm-hmm.
anytime an abnormal lab really comes through, then the patients are like, "Hang on a second, what's wrong with me?"
Right.
And they think worst case scenario. But just
Right.
as long as we're able to, explain to them what is causing it, or maybe just recheck it, and then it goes away, we're like, well, it's nothing to be concerned about.
Agreed.
Yeah. So, what do you feel about the BRCA gene? So, do you think that people should be getting them, like if they have the family history of breast cancer, like close family history?
Well, oh boy. It
So
really,
BRCA, just for explanation, everybody,
yeah.
that's the gene that basically, if you have a family history of breast cancer, is something you can get tested for to see if you're more at risk for developing breast cancer yourself.
Yeah.
So
It really comes down to family history. When did that family history. When did those in the family develop breast
Yeah.
cancer or ovarian cancer? Did they get tested, and was it positive or negative? Because that plays a role. If it's positive, then yes, you definitely want to reflex to, you know, the daughters or the nieces getting tested. But if it's negative, then the likelihood is low. And so again, it depends on the dynamic of what's going on too. And age too. The younger somebody is, it plays a role in getting diagnosed.
Yeah. Lucia says, are there any herbal holistic remedies that may assist in the treatment of cancer?
Absolutely. And that's what I do a lot with patients, is looking at what are some vitamins and supplements that they can take while they're going through treatment, as well as what can they take when they're finished to really kind of rev up and boost their immune function and increase their overall health and wellness. But again, it's so specific. I think, you know, two right out of the gate that are really pretty non-controversial. Vitamin D is super important. And so many people have a deficiency in vitamin D. That's almost kind of a no-brainer. And then a multivitamin could be useful, just simply because going through treatment, most people are not eating well because they don't feel good.
Right.
So those two would be pretty non-controversial. And then but diving into their nutritional status is really important. Are they a diabetic? You know, just all of that plays in.
Chris says, how does generational concerns come into play? So my mom had cancer, kidneys, and now I worry. I've just passed the point where she passed in age. Anything I should be looking for?
Yeah, so generally, the majority of cancers are not related to a genetic dynamic. You know, that's less than 10% of cancers. But I know that there's always that worry and that fear because you've had it in your lineage, so to speak.
Yeah.
And so then you look at, I think it's really important that people use that as a tool to work on those foundations of health. You know, work on dialing in your nutrition, work on dialing in your movement or what your sleep. Stress is a big one. I mean, one of my questions that I always ask patients is, what do you think caused your cancer? And I will tell you that probably 95% of my patients will say stress. And they can pinpoint it to a really intense, stressful situation in their life. And they'll say, I just know it was my divorce, or I know it was this job that I had, or I know it was whatever. And so really dialing in on trying to figure out how to reduce your stress level is super key, because that in fact causes so much inflammation in the body as well.
Right. Cortisol levels fly high. Yeah. Yep. All that.
Yeah.
That's a really good tip. I didn't even think about all those things. That's awesome.
I didn't. Yeah.
Yes.
And I have so much stress. I'm sitting over here thinking, oh my gosh, I need to get my stress.
Right. I'm like this. What did I just
I'm not thinking cancer. I'm just thinking like in general, stroke, cancer. There's so many things based on stress.
Yeah. For sure. You think about your blood pressure going high. Yeah.
And what do? We like wear a badge of honor that we are not sleeping well and we're stressed out. Like, you know, I've got this massive deadline, or I'm not sleeping, or I'm, you know, and instead of focusing
think we're doing
on
the right thing, we think we're working hard and we're pushing through and
but really we're just wrecking our health, and we're not considering that.
Cortisol, how do we check for that? Can we check for that? Yes, you can. So your cortisol levels can be checked by your primary care doctor, or sometimes endocrinology can get involved. It's just a simple blood test, but they usually won't check it unless you've had a lengthy period of a stressor or something of that nature where they feel like it's appropriate to check. Otherwise, that's one of those insurance things where they won't cover it.
Yes.
They'll be like, nah.
But
I've been feeling stressed lately.
Right. Well, some of the things that you can do before you get to that level of checking cortisol would just be to check like insulin levels and a fasting glucose and a hemoglobin A1C and some inflammatory markers like a high sensitivity C-reactive protein, so that you're looking at, is there already inflammation building up? Because it's pretty safe to say that if those things are out of whack, then cortisol's probably going to be out of whack too.
Yeah.
And so you can kind of get around those insurance dynamics. So
what are the types of foods that you recommend that people try to stay geared toward to help
or stay away from?
Yeah.
So it's interesting. You know, a lot of patients get to me and they're like, oh, I got this diagnosis of cancer and I went vegan.
Yeah.
And that I see being problematic because especially in women as we age, the majority of women that I see are not eating enough protein, and we need protein for the amino acids to maintain muscle mass, to stay strong. And that's a huge component. I also see when people go vegan and vegetarian, they become nutrient deficient, and that is problematic. And so not to say that you can't do those things, but you have to do them well. And that's where I see people lacking. So I take a very whole food approach, clean whole foods. If you can avoid added sugars, processed foods, and stay away from the vegetable and seed oils, you are way ahead of the game. And those vegetable and seed oils are things like canola oil, corn oil, cottonseed oil, soybean oil, safflower oil. Well, so those things are not typically what we use to cook with, but look at every package. Go to your pantry when we're done.
Okay.
And you will see that the majority of packaged foods have those oils in them. And they are very problematic. They irritate the gut. They cause inflammation. So if you can eliminate those, eliminate added sugars. And again, the sugar component is interesting because when you look at labels, it's not just that sugar. It doesn't just say sugar. You know, there's upwards of like 200 different terms for sugar. So you have to really look at that. And I say, if you're going to buy something packaged, have it, look at the ingredients. If it's less than 3 to 5 ingredients, you're probably doing okay. But you want them to be clean and whole as much as possible. And if you're eating meat of any type, you want to make sure it's good sources, grass-fed, grass-finished, pasture-raised,
Which
all
brings
of those
us
things.
to the fact that eating well costs money.
Yes, it does. However, there's ways to do it where you can still eat well on a reasonable budget. And I think that we just there needs to be more conversation about that. And I know that there's food deserts out there, and I know that there's manipulation, especially in some of the marginalized communities with fast food and convenience stores. And so it's so multidimensional but it's got to start with education. And how do we get that education out there? I mean, I will tell you that where I was working before, outside my window, I could see the KFC that was the most profitable in Northern California. And so that was a dynamic that I was fighting against on a daily basis. And it's a huge challenge, but it can be done. It can be done. And I think we just have to, as a society, we definitely can do better.
I have had someone say before, if you go grocery shopping, try to avoid the aisles.
Yeah.
Because if you're in the fresh fruit, fresh vegetables, and then you get your meat and your eggs and your milk, you come back around and you're good. Right?
Absolutely.
Wow.
Well, and even
all the processed stuff is in the aisles.
Right.
I'm just trying to reduce my meat intake so much. That's me. So I'm putting heavy, like I made a soup the other night and I had bell peppers and carrots and onions and everything in it, and just like a handful of meat.
Yeah. Well, and it depends. Like everybody's unique. And so, you may have heard this, but I sometimes will talk to patients about how, animals can run away from us, right? If we're out hunting, they can run away from us. Plants cannot run away from us. And I mean, I know that sounds kind of kooky, but so they have mechanisms within their leaves, their stems, their seeds, their pods that make us not want to eat them, whether they be bitter or sour or something along those lines. Now, fruit is a different dynamic because when animals eat the fruit, right? They're taking in the seeds, and then what happens? It goes through the GI tract, it gets excreted, and hopefully those seeds become another plant, right? But with vegetables, you have to be cautious. So I have some patients that can't eat certain vegetables. It's really toxic on their gut. And so we look at an elimination diet. And if you look at a good elimination diet, one of the things that's never eliminated is meat, because it's part of our ancestry. So we can digest it well. So again, Zenzela, it just depends on who the patient is and what's going on and where can we build their health from.
Yeah.
All right.
Yeah.
Thank you so much for joining us today.
Yes.
And you have shared a wealth of information that we are
Thank
very
you for
grateful.
having me. This was great.
Yeah, we had a lot of fun. So everyone, we hope you'll tune in with us again. Connect with us on our business and social media pages. If you would like to speak with Miss Kristie, she can be reached at Howlett. That's Howlett
Integrative
Cancer Treatment. Cancer Care. Into Howlett Cancer Care. There it is. And her social media is down below. Check it out. And so if you guys have any questions, suggestions on healthcare topic you'd like us to cover, send us a DM and we will get back to you if you have any questions that you've left in our comment section. We hope you stay well until next time. Bye.
Bye.
Bye.